Assalamu alaikum beta. In this video lecture I will deliver the lecture on non-inflammatory blistering disorders. Okay, in the previous part I delivered inflammatory blistering disorders that included pemphigus, bullous pemphigoid and dermatitis herpetiformis. Okay, and these non-inflammatory blistering disorders, obviously in skin you will come to see some blisters, but obviously they will not be associated with inflammation. Okay, as simple as possible. And these non-inflammatory blistering disorders include number one, epidermolysis bullosa, which we will talk about in a little bit detail. And number two is porphyria, which is not very much described in your textbook, so we'll have few words on porphyria as well. But yeah, let's start with epidermolysis bullosa. But beta, before we go to epidermolysis bullosa, let's quickly recap this in histology of the skin we actually discussed in the previous lecture. So can you see beta? Yeah, this is the histology of the skin. This starting from here down here, this is your epidermis. Okay, has got how many layers? This layer is, you can see, this is stratum corneum. This is stratum corneum, this is stratum granulosum, and this a little bigger one is, little thicker one is stratum spinosum, and this nice little layer is basal layer, basal cell layer. Okay, and then is these couple of layers which make up the basement membrane, lamina lucida and lamina densa. These two together make up the basement membrane, and then below the basement membrane is dermis. Okay, yeah. And beta, in throughout the epidermis, okay, whatever layer is, two cells are held together by these intracellular molecules, intracellular junctional complexes called desmosomes. And beta, some important proteins that make up the desmosomes. What are desmosomes? These are intercellular junctional molecules which hold two cells together in all the layers of the epidermis. Okay, like you can see in the basal layer, these are desmosomes. Okay, which hold two cells together. So desmosomes are actually made up of very important proteins like desmoglein, desmocolin, plakophilin, plakoglobin, and desmoplakin and keratin. This is the important protein, by the way, which we will talk about now in case of epidermolysis bullosa, and this is the protein we discussed in case of pemphigus, if I'm not wrong. Okay. Yeah, furthermore, can you see these nice little green colored proteins? These are actually the proteins which actually are doing what? They are actually connecting the basal cell layer to lamina lucida, or I can say this is connecting the basal cell layer to basement membrane. Okay, and then from basement membrane some these red colored fibrils are coming out. These are anchoring fibrils, okay, which are connecting your basement membrane with this layer, which is dermis. Okay, so what is connecting the basal layer to basement membrane? It is hemidesmosome. And what is connecting the basement membrane to dermis? It is anchoring filaments. Okay, so now let's start with the non-inflammatory blistering disorders that at number one includes epidermolysis bullosa. Epidermolysis bullosa, it is an inherited or acquired defect in structural proteins. Structural proteins, I mean to say the proteins we just discussed. Like it can be proteins present in desmosomes. Okay, it can be proteins that make up hemidesmosome. Okay, it can be proteins that make up these anchoring filaments. Okay, and I'm not going to repeat what are these entities. Okay, now you should be very much clear with these. Okay, so in case of epidermolysis bullosa, there is inherited, that is by birth, or acquired defect in structural proteins. These structural proteins, one of these three. Okay, with no associated inflammation. Right, what happens if there is a defect in these structural proteins? Blisters appear on the skin, especially at the site of the pressure, at the site where you rub the skin, or at the site of minor trauma, at or soon after the birth. Okay, at birth or soon after the birth. Right. Okay, and there are bit of four types of epidermolysis bullosa. If you understand these four types of bullosa, you will have better understanding of this topic. Number one is simplex type. By the way, it is the most common type of epidermolysis bullosa. Simplex type is most common type. Okay, up to 75% to 85% cases are of simplex type. What happens in simplex type is there is actually autosomal dominant mutation in the gene, which encodes keratin 14 or keratin 5. Okay, and now you should have in your mind that these two proteins, these keratin proteins, are actually the very important component of what intercellular junctioning molecule. If I take you here, can you see? And now tell me, keratin, even it can, okay, 15, 14 or 5, whatever keratin complex it is, but can you see keratin is the very important protein of what intercellular junctioning molecule? It is very important protein of desmosome. And what is this desmosome doing? It is connecting two cells in the epidermis, in the all the layers, you know, stratum corneum at the top, stratum granulosum, spinosum, basal layers. Okay, so beta, in case of, you know, simplex type, these keratin proteins are not going to be, you know, synthesized because of gene mutation. Keratin proteins are not produced. So if you think, if these keratin proteins are not there, you think desmosomes are going to be, you know, very much stable and very much healthy? No, no keratin, no desmosomes. एंड स्पेशली इट अकर्स एट द लेवल ऑफ बेजल सेल लेयर. तो बेटा सिंप्लेक्स टाइप में क्या होता है, ऑटोसोमल डोमिनेंट म्यूटेशन होती है ऐसे जीन्स में जो कि क्या बनाते हैं, केराटिन प्रोटीन. ठीक है, और बेटा जब ये जीन म्यूटेट हो जाएगा तो केराटिन प्रोटीन नहीं बनेगी. केराटिन प्रोटीन नहीं बनेगी तो डेस्मोसोम नहीं बनेंगे, खास करके किस लेवल पे, बेजल सेल की लेयर पे. ठीक है बेटा, तो कुछ ये पिक्चर अपीयर हो जाएगी. जब ज़ाहिर है बेटा डेस्मोसोम नहीं बनेंगे तो दो सेल्स आपस में कनेक्ट नहीं होंगे, वो सेपरेट हो जाएंगे. और क्योंकि ये सिंप्लेक्स टाइप खास करके बेजल सेल की लेयर पे, लेवल पे होती है, तो आप देख सकते हैं बेटा ये कॉर्नियम इंटैक्ट है, ग्रेनुलोसम इंटैक्ट है, स्पाइनोसम इंटैक्ट है, लेकिन ये जो बेजल सेल है वो सेपरेट हो गई है. आप देख रहे हैं बेटा, इसके कुछ फ्रेगमेंट्स ऊपर रह गए, कुछ फ्रेगमेंट्स नीचे रह गए हैं. उसकी वजह क्या है बेटा, क्योंकि बेजल लेयर की लेवल पे क्या हुआ था, बेजल लेयर की लेवल पे डेस्मोसोम्स अब स्टेबल नहीं है, डेस्मोसोम्स डिसरप्ट हो चुके हैं केराटिन के ना बनने की वजह से. ठीक है, जिसकी वजह से बेजल सेल लेयर का एक फ्रेगमेंट जो है वो ऊपर रह गया और एक नीचे रह गया. ठीक है, और बाकी बेसमेंट मेम्ब्रेन तो नीचे अपनी जगह पे है. ठीक है, सो दिस इज़ द साइट ऑफ द ब्लिस्टर. सॉरी, and this is the site of the blister. Isn't it the fluid filled blister here? Due to separation of the cells, space is created which is filled with fluid and the blister is formed. Can you see this blister beta? And there was a free space which was actually filled by the fluid, and this is now blister formed. What is the roof of this blister? ये पूरी एपिडर्मिस, या फिर पूरी एपिडर्मिस ना कहूँ तो कहूँ कि ये 3 लेयर्स और कुछ फ्रेगमेंटेड बेजल सेल्स. ओके, these 3 layers and not complete basal layer but few layers, few cells of the basal layer. And what is in the base of this blister? Few basal cells and this basement membrane. Okay, yeah. Beta, this is the simplex type of epidermolysis bullosa and it is very much common type. After this simplex type is junctional type. Beta, in junctional type there are no autosomal dominant mutations but there are autosomal recessive mutation. At autosomal recessive mutation in what gene? It can be in gene which encodes subunit of laminin or in the gene which encodes BAPAC2. I hope you know BAPAC2. What is this protein? This protein is very important component of hemidesmosome, and you know beta what does hemidesmosome do? They connect the basal cell layer with your basement membrane. And what about this laminin? Laminin is a multi-component protein located in the lamina lucida, and this laminin is the protein that binds to both hemidesmosomes and anchoring filaments. Beta, if there is autosomal recessive mutation in the gene which encodes laminin protein or BAPAC2 protein, guess what is going to happen? Guess what is going to happen? BAPAC2 is very important protein of hemidesmosome. If there is no BAPAC2 or no laminin, you think beta epidermis will be any more connected with basement membrane? Because laminin and BAPAC2 are very important proteins. They connect epidermis to basement membrane, especially BAPAC2 in hemidesmosomes. It connects epidermis to basement membrane. If these proteins are mutated, you think epidermis will be attached to basement membrane anymore? No. See here in this picture, this is the junctional type epidermolysis bullosa. Can you see all 4 layers of epidermis are separated? And this is the basement membrane and dermis, and this is free space left after the separation of cells, and this is the blister space. This is fluid filled blister. Okay. What is in the roof of the lesion? Intact epidermis. What is in the base of the lesion? बेसमेंट मेम्ब्रेन और उसके नीचे डर्मिस. ओके. और बेटा ये क्यों ब्लिस्टर बना? क्योंकि जो आपके हेमीडेस्मोसोम्स में मौजूद बपाक2 प्रोटीन थी, ठीक है बेटा, वो म्यूटेटेड हो गई है. अब क्योंकि बपाक2 प्रोटीन नहीं रही तो हेमीडेस्मोसोम नहीं रहे. हेमीडेस्मोसोम नहीं रहे तो क्या ये बेजल लेयर बेसमेंट मेम्ब्रेन के साथ मजीद अटैच रहेगी? नहीं रहेगी, सेपरेट हो जाएगी, बीच में स्पेस बनेगी और वो फ्लूइड फिल्ड हो जाएगी और ब्लिस्टर बन जाएगा बेटा. ठीक है. ओके. आफ्टर दिस जंक्शनल टाइप आई हैव नंबर 3 टाइप ऑफ एपिडर्मोलिसिस बुलोसा, दैट इज स्कैरिंग डिस्ट्रोफिक टाइप. बाय द वे, it can be autosomal dominant or recessive, but whatever it is autosomal dominant or recessive mutation in what gene? COL7A1 gene, which encodes what protein beta? Type 7 collagen, which encodes type 7 collagen, and type 7 collagen is very important component of anchoring fibril. Now you guess beta, normally what is the function of anchoring fibril? To connect basement membrane with dermis. Okay. And type 7 collagen is very important component of anchoring fibril. If there is no type 7 collagen, there will be no anchoring fibrils. And if there are no anchoring fibrils, what do you think is going to happen? If there are no anchoring fibrils, there will be no attachment between the basement membrane and dermis. Basement membrane and dermis will be separated. Okay, now you can see here, this is the epidermis and this is the basement membrane, and it is separated from dermis, and this is the free space formed, and this is the blister actually, right? And can you see what is in the roof of the lesion? There is intact epidermis and basement membrane. And what is in the base of the lesion? What is in the base of this blister? Dermis. Okay. Yeah, this is about the scarring dystrophic type, right? At number 4 is mixed type. This is not actually a type, but it is actually combination of all above 3. In case of mixed type, the defect can be at the level of basement membrane and dermis. Okay. And at the level of epidermis and basement membrane. Okay. So this is actually like defects at multiple levels, right? That is all about 4 types of epidermolysis bullosa. I hope you are clear with this beta. Epidermolysis bullosa is included in non-inflammatory blistering disorders. One more condition included in non-inflammatory blistering disorders is porphyria. Not very much described in your textbook, but a couple of words. Porphyria beta, let me tell you, it is an uncommon inherited or acquired problem of porphyrin metabolism. Some enzymes are actually mutated. And due to the mutation of those enzymes, the metabolism of porphyrin is inhibited or not continued in the normal fashion. So metabolites are accumulated. Look, let's suppose this is reactant number A and it produces product B, and product B then converts into C. And for the conversion of product A to product B, you need enzyme X1. And for the conversion of product B to product C, you need an enzyme X2, let's suppose. And if let's suppose this enzyme is mutated or deficient, you think this A is going to be converted into B? No. So the levels of A in blood will be high then. Similarly, this is the case. If let's suppose X1 is normal, so A will be converted into B. And if let's suppose X2 is not normal, so B will not be converted into C. So what will happen? The level of B in blood will be increased. This is the case in case of porphyria. The different metabolites are actually accumulated due to absence of certain enzymes. Okay. Especially this porphyrin pigment is present in hemoglobin, myoglobin and cytochrome. By the way, there are different types of porphyria which you will better understand in your biochemistry. Congenital erythropoietic porphyria, erythrohepatic protoporphyria, acute intermittent porphyria, and a very important and the most common type of porphyria is PCT, that is porphyria cutanea tarda, and at last is mixed porphyria. What happens in case of porphyria? What are the skin manifestations beta? some blisters appear. किस तरह के blisters? खास करके vesicles appear on the skin which are associated with scarring, and these lesions on the skin which are vesicles, they are further exacerbated by sunlight. Okay, sunlight exposure. By the way, these vesicles are subepidermal in location. If you have a look at the histology of the lesion, then you will see that this is the epidermis, and below the epidermis is blister actually, then is the basement membrane, and then is the dermis. Okay, so this is epidermis, this is your basement membrane, this is dermis. Okay, this is blister, this is blister, and can you see this blister is subepidermal in location. So subepidermal blisters are formed in case of porphyria. Okay, uh, and by the way, in case of porphyria, the dermis contains vessels, which are blood vessels, which are very much thickened by glassy deposits of serum proteins, including immunoglobulins. So what did you learn so far in porphyria, beta? In porphyrias, the metabolism of porphyrins is actually inhibited due to deficiency of enzymes, which is due to their mutation in genes. Okay, what the most common type is, by the way, PCT. And what are the cutaneous manifestations of porphyria? On skin, you come to see blisters, especially vesicles, which are exacerbated by sunlight. Okay, and at the histological level, you see the blisters are present at the subepidermal level. Okay, and in dermis, you will see the blood vessels which are present. They are very much thick, very much thick. Why they are thick? Because of deposits in their walls. Deposits of what things? Look, if this is the blood vessel present in the dermis, if I just bring it out, this is the blood vessel present in the dermis. In the wall of, in the wall of this blood vessel, what happens in porphyria? In the wall of dermal blood vessels, can you see something is deposited? Due to the deposition of this something, the wall has been very much thick. What is this something deposited? These are actually serum proteins, especially immunoglobulins. Okay, so this was a short review of porphyria, but you can better understand this topic in biochemistry. For now, this is all about beta non-inflammatory blistering disorders of skin. Okay, if you have any question, beta, you can ask me anytime, anywhere. That's all about the lecture. Class dismissed.